Bugaba, this tiny and remote island of Kalangala, has been home to Byakatonda Ibrahim and Dalila Irneza for close to 7 years. 2 years ago, they had a baby, but nearly at a cost of Irneza's life.
Mchala wange olubuto lwamukwata zaali ziri saawa nga 6 z'ekiro, naye obwo lwamala okumukwata twagezaako okunoonya entambula esobola okumutwala okumutuusa ku ddwaliro n'etubula. Okuva wano kukkirira kutuuka ku mwalo waliko akagendo, namwe muyiseeko mulabyewo enjero akagendo akaliwo oyo w'eryato eyali antutte ekiro ekyo yansaba $10,000.
The long wait prolonged Irneza's labor, and by the time she was delivered at Bufumira Health Center 3, situated on the next island, she required a cesarean operation, which the facility could not handle.
Mukaseera ako tekaali kangu twatuuka ku lwaliro kale saali mu mbeera ennungi nga bw'omanya embeera z'omuzadde. Bagezaako abasawo ne bugaana era bwe byagaana ne basalawo okundongoosa okusigaza obulamu bwange n'obw'omwana ali mu lubuto.
Bugaba and other neighboring islands are served by Bufumira Health Center 3. It takes about an hour and a half on a motorized canoe from Bugaba to Bufumira at a cost of 50,000 to 100,000 shillings, an approximate of $15 to $25, and that is only if the canoes are available. For medical emergency situations like that of Irneza, the prices even triple.
Ofuna eryato erikutwala e Kalangala byetaaga ssente. Ebiseera ebisinga singa bibeera misana bakusaba $5,000 kutuuka ku ddwaliro. Singa biba kiro oli akusaba $10,000 n'okusoba.
$10,000 kwe kubeera zikutwala ne zikomyawo.
Nedda okukusa omusaki okukutuusa wali.
Ebyobulamu byandibadde entambula yetuleeteramu obuzibu. Okusookera ddala nti omuntu bw'afuna obuzibu ng'akaseera ak'ekiro mukaluubirizibwa okufuna entambula okubeera nti emutwala ku ddwaliro kubanga wano amalwaliro gatuli wala. Oba oli awo mwandidduse nti mudduseeko mu kakiriniki naye kiriniki tesobola kuwa ekyo kye musuubira.
The district of Kalangala consists of 84 islands on 9,103 square kilometer expanse of Lake Victoria. Its 66,300 residents are served by only 21 health facilities. Malaria and other waterborne diseases are rampant. At Bufumira, I met Proscovia, who has served as a nursing assistant for 4 years. She says medical access challenges in catchment areas is a blend of geographical and social structure setup.
Because we are now 14 staff, both medical and non-medical. Yes, that is the total of the staff we have here. So we cannot be enough because of the setup still. And you find that some of us, we can go for off and then annual leave. We are entitled to have it. So if any of our staff go for that, we find it hard to serve our clients because we are few. The geographic setup of this site is not that friendly. The weather, it changes, and then most of the catchment area of this facility are in waters.
Healthcare funding in Uganda is still low. Only 7.4% of the national budget went into healthcare in the financial year 2021-2022. This is way below the 2001 Abuja Declaration, which requires African governments to commit 15% of their budget to health access. While this takes some time, there is hope. A logistical innovation is working to mobilize medicines and medical workers from government facilities to remote and hard-to-reach communities through mobile clinic outreaches. I met with Costa Rita Nalukwago, the project's manager, as she mobilized medical workers for the camp in Bugaba. The Health Access Connect initiative believes that the monthly medical camps are the sole alternative to people who may not be able to access facilities. We took a canoe with Costa Rita and other members of her team from Kalangala to Bufumira Health Center 3, where she went to mobilize medicines and health workers for Bugaba camp.
What this mid-cycle model is looking at solving is one of the factors that affect access to healthcare, which is distance. So distance stands in the way of many people receiving their ideally supposed to be free services at the health facilities. The model works basically in a way that the health services are taken to the community, but with the community fully involved to actually bring these services closer to them.
This system informs community leaders of an impending visit by health workers. They then mobilize fuel for canoes that transport health workers and medicines, and also provide makeshift treatment centers where patients can be treated with privacy. The camp costs 2,000 shillings for adults, while children are treated at 1,000 shillings, an approximate of $0.54 and $0.27 respectively. The World Health Organization has recommended motorbikes and boats as the best alternative means of transportation to access healthcare in low-resource settings like Bugaba Island. Mark Kayongo is the community boat sailor who came to pick us up at Bufumira. He was very assuring.
Nga bwondaba ndi musajja mumanyirivu era nsobola okumanya nti buno budde bubi tetusobola kutambula ku mazzi, buno budde bulungi tusobola okutambula okusobola okutuuka okulaba nga abasawo batuusa bulungi nga tebafunye buzibu bwonna.
Communities look forward to these medical camp days with great expectation. Alex Bahati, 28, has invested in a megaphone and combs every nook and cranny of the community to ensure that all can attend.
Sinzira abantu benina mu kitundu ndaba ng'embeera gye balimu si nnungi balwadde. Ekirala ti transport asobola okuntwala okuntuusa Bufumira ng'omulwadde aba mungi. Akasimu nkafuna oluvannyuma lw'ennaku nga 4 nga tebannatuuka ne mpita mu batuuze bange kuba ebyalo bye balimu eyo wansi eyo walako baba balina okuntegeeza nga bukyali. Ne mpita mu batuuze ne mbategeeza nti tulina abasawo abasobola abajja okutujjanjaba era ne mbagamba olunaku ne basobola okujja mu olwo olunaku lwe mba mbagambyeko.
Nanono Proscovia serves at Bufumira as a nursing assistant. She decided to leave the comfort of their offices today. She notes that the demands can be overwhelming here. What kind of services do you bring to people, and especially today, what is available?
We target OPD. OPD has so many sections. We handle TB, we handle all general diseases. We treat them, we diagnose. We have laboratory, we can do HIV testing, we can do malaria testing, we are doing syphilis testing. But where we are now, you come with some, and unfortunately you find those people which need those services you have left at big hospitals. So sometimes you refer.
But she says the camp presents an opportunity to reach people she may not have met if she was at the health facility.
You know, manners at the facility, they can't be the same at the working area. Here people, they behave, you find drunkard people, you find all kinds of people, sexual workers, you find old people, young people, and all of them have different characters. So as we are trained as me, a health worker, I know how to handle everybody. I can't say that you are drunk, you can't get services.
This initiative has existed since 2015. Irineza told me, much as it is the only mechanism they bank on each month to access services, it still lacks things like mobile labs that are critical to their health. But she says the outreach has really answered quite a lot of her family needs.
Genda kale nobabuulira obuzibu bwo obukuluma ne bakuwa eddagala naye tekyabulamu.
Isooka senyiga nnuma, nyina omusujja gwonnuma, nyina abaana bange baabo balwadde senyiga, balwadde wamu n'omusujja, wamu n'omukyala wange si mulamu bulungi. Era namazidde okwewandiisa nabo ne mbateekesaayo, nsuubira okufuna obujjanjabi obwo obulungi ennyo obutuleetera buli kaseera.
Kinsanyusiza nnyo kuleeta kugema baana. Kubanga okugema omwana olina ogenda kaazi ate lumu mu mwezi oluusi ne batajja.
Nanono Proskovia told me that the camp depends on nearby health facilities for medicine and staff.
I wish like Kaz is having a health center too, that this person can, if he gets a problem, instead of waiting for her to come, can travel from here up to Kaz to get services from there.
Amazzi tetuyina ntambula sobola otwanguyiza mu bwangu ng'omuntu ali bubi.
Ekitundu kino tetulina kiriniki.
Eddagala tono, tewali ddagala.
The Ministry of Health says it's mooting a plan to build an efficient medical evacuation system to buffer one it has currently.
Cancer has a mobile clinic. The same applies to TB. So we will expand these mobile clinics as and when, but now we extend them to do most screening and sensitization.
Remember the treatment fees we talked about? Kayongo tells us what the money is used for.
Mu mbeera y'okulaba nga tusembeza obujjanjabi buno oba okulaba nga abasawo bano musobola okubatuusa ennakawaje okujjanjaba abantu era abatuuze be bavaamu akasente ako akatono okulaba nga basobola okuŋŋaanya amafuta ago ag'abasawo.
In the last 5 years, Health Access Connect has established 1,000 outreach clinics. These have served an estimated 46 patients upon each field visit, totaling to about 43,845 patients.
I think we have seen a lot of improved access to health care. We have seen a lot of, because when you look at how much is being collected at outreaches versus what people would spend to reach the health facilities, then it leaves a saving for the family income. We want to see a Uganda that has well-balanced healthcare services, kind of equity. We want to see health equity in service delivery.
Nakawa, a village with more than 2,000 people, has no health facility. A camp like this is the only hope for such people. Reporting for Solutions Now Africa, I'm Roneta Twini.